My name is Pete Lucas, and this webinar is being hosted by University Gastroenterology based in Providence, Rhode Island. And here's a look at our esteemed panelists here. Today we're talking about World Hepatitis Day again, Find the Missing Millions. And a little bit about UGI, University Gastroenterology, consists of 25 physicians and 8 nurse practitioners, making it the largest and most comprehensive GI practice in Southern New England. And today we have a very important topic, very timely, as it is July 28th, World Hepatitis Day. We're with the liver specialists at University Gastroenterology to discuss hepatitis and this year's theme of Find the Missing Millions. Here with us are Dr. Eric Newton, Brandy Milovic, Dr. Ravi Nadapalli, and Dr. Thomas Seepy. Thank you all for being here today. Again, World Hepatitis Day, very important topic, and I think a lot of folks look at GI and look at your practice and don't see what the connection is to liver and how important it is. So Dr. Newton, we'll start with you and talk about UGI and what the Liver Center is at University Gastroenterology.
So the Liver Center is really sort of an umbrella term to encompass all of us and what we bring to patients who we see with liver disease. So we bring a level of expertise, exposure to clinical research, years of experience, and a team-wise approach to patients who have liver problems. And we work together and have access to certain technology like FibroScan, which we'll talk about more in the future, that allows us to, again, evaluate patients who we see with liver problems. A lot of times, as you mentioned, people who hear gastroenterology don't think liver or liver problems. This is one of the major things that we do, is we see and take care of patients who have liver disease and liver problems and help them from diagnosis through treatment and beyond.
Great. And Dr. Seepy, we'll head to you next with today's topic, hepatitis. What is it and why is it so important? There's a World Hepatitis Day. Tell us what it is and why awareness is important.
Well, thanks, Pete, for having me. Hepatitis simply means inflammation of the liver. And there are numbers of various substances, infections that can cause inflammation of the liver, from viral hepatitis infections, most commonly hepatitis B, C, hepatitis A, there are others, to medications can inflame the liver, alcohol can inflame the liver. A growing epidemic or pandemic in the United States and even globally is inflammation by fat being stored in the liver, which is going to be a major cause of advanced liver disease in the United States in the very near future. I think on a global perspective, when we think about World Hepatitis Day, we're talking about probably mainly hepatitis B and C as a focus. There are 257 million people in the world that have hepatitis B active infection and another 70 million that have hepatitis C on a global basis. So that's a large number of patients who have active inflammation and potential damage and advanced liver disease from 2 viruses that are very readily treatable and even cured in the instance of hepatitis C. Much more to say, but maybe I'll stop there at this point if you have other feedback questions.
Sure. And we'll go around the horn, as we say, and touch on a lot of these different topics, and certainly feel free to follow up. Dr. Nadapalli, we'll talk next with you about the theme, the missing millions. We're not talking about the missing tests, the missing thousands, we're talking about the missing millions. What does that mean?
Well, the term the missing millions refers to the fact that of the huge number of patients who have hepatitis B and hepatitis C, as Tom has mentioned, close to 90% of those patients are not identified. So there's a huge untapped reservoir for these viruses, and people who are walking around completely unaware that they are infected with hepatitis B and hepatitis C. There's a variety of reasons as to why that is. A lot of it is related to a lack of awareness, both on the part of patients and in some cases on the part of physicians in terms of knowing who to screen and when to offer this test to people. But the fact of the matter is we have good medications, particularly in the case of hepatitis C, which we have a number of medications that are effective at curing the virus. But we can't do that without identifying the people out there who are walking around with this disease.
And Brandy, we'll switch to you. Talk about some of those treatments. How does the screening work? How does the test work and some of the treatments you offer, in particular the FibroScan in the office?
Screening is really a simple blood test. I mean, the CDC has changed their guidelines for screening for hepatitis C. We used to just screen high-risk patients, baby boomers, patients that were born between 1945 and 1965. And now they're recommending that anyone over the age of 18, children of baby boomers, are now getting screened. The simple antibody test, a lot of the labs will reflex over and go on to further identify patients that have chronic hepatitis that would require treatment. I think what everyone needs to know is, the other physicians had mentioned, is treatment is accessible now. It's more simplistic. There aren't the side effects that were known with prior therapies, and we can cure people within 8 to 12 weeks. We have FibroScan here in our office because these people also need to be staged and determine if they have advanced liver disease and even cirrhosis. We often don't need liver biopsies anymore. So people that were afraid to come in for screening, given concerns of older therapies, side effects, concerns about having liver biopsy, we don't need to worry about that as much anymore, because it's much better than what it used to be.
We've gone kind of in depth with video on the FibroScan, and we've profiled it, or had it profiled in the news. Talk about what that is and how it works, and how non-invasive the treatment that is.
FibroScan is a non-invasive way to quantify how much fat is in a patient's liver, and it also goes on to quantify how much scar tissue or fibrosis a patient has by simply placing a probe on the right side of the patient in between the rib cage, and they feel just a little thump as it sends sound waves through the liver, and it will give us a number, so we can ascertain how much damage is there instead of getting an actual tissue, that the pathologist would have to look at underneath the microscope. And it's non-invasive. It doesn't hurt. Patients are just required to come in fasting for 4 hours prior to their test. The test itself takes maybe 10 or 15 minutes to do, and the results are instantaneous.
Great, right there in the office. And that's done in the Providence location. Does that machine move around throughout the state?
It does not move around throughout the state. We have it here. There are newer models, I guess, that can be brought from office to office, but our machine stays here in Providence.
Okay, great. And switching over to clinical trials, I think now more than ever, the public is aware of clinical trials, right? Looking for a cure to COVID-19. But Dr. Newton, clinical trials is something that you at UGI and your group has prided yourselves on, kind of the latest treatments for liver disease. Talk about that and how you're at the forefront for a lot of these treatments.
Yeah, so, Dr. Sepe is really the one that sort of spearheaded a lot of the clinical research here for many years. But again, we are a team, and we certainly assist him in that endeavor. But as drugs are developed, they need to go through certain phases of study before they can be accessible to the public. You need to make sure that the drugs are safe and then effective, and figure out the proper dose for people. And it needs to meet certain ends and goals, again, to make sure that it's doing what it's designed to do. And so oftentimes we have access to these drugs in these clinical trials, so people can have access to these medications before they reach the general public. And it's a nice thing that we can offer patients, where there may not be any medications out on the market that treat them as effectively as some of the drugs coming out in the future. We can get them access to these drugs sooner than they might otherwise have. And it's an important piece to developing medication and treatment, and we learn from it. It allows us, these trials allow us to learn what works and what doesn't work, and to make sure that we're bringing safe and effective therapies to the public. So again, it's a nice thing that Dr. Sepe has sort of spearheaded this for us, and I think it's a great thing for our patients to partake in.
And Dr. Sepe, I'd like to hear from you about that. You've helped build this over the years, and just before we jumped on here, you talked about another trial looking to you as someone to test this. So when the patients, maybe ask, or do you have the latest techniques or latest treatments? You certainly do. These companies look to you for these trials. Talk about why you thought it was important to build that here at UGI.
Briefly, I did clinical research as a fellow, and I brought that initially into my private practice, but I was kind of out of focus in what I was doing 28 years ago. And after a couple of years, decided that I wanted to really focus on my love, which was liver disease, and formed a very robust clinical trials unit in chronic liver disease. And we're really proud because the two mainstays drug treatments for hepatitis C that are curative, including the rescue drug that's there in case they fail, we were heavily involved in that development in the last 5 years, that we did all the phase 2 and phase 3 trials. So it's a nice example of how, being aware and picking, when we pick trials, we don't pick trials for any other reason but to bring value to our patients. Because there are many, right now we're in declining more trials than we're accepting. It really needs to bring value and important opportunity to our patients to try to deal with an unmet need. At Hep C now, that we have curative therapy. I think we can cure 999 out of 1,000 patients that walk through the office because we're experienced at doing it. I think there are newer interests in hepatitis B again. There was a strong interest in reviving that, kind of slowed with COVID. And then the major thrust of our liver unit right now is actually in the areas of fat-related liver disease or steatohepatitis and reversal of fibrosis. I'm also really proud, though, that the three of us are members of an affiliated research group, Nexus Research, that is launching a complete array of clinical research opportunity for UGI patients, from liver disease to inflammatory bowel disease to other potential therapies. So based upon experience and our interest in bringing value to our patients, we're actually going to be expanding what we could bring that brings state of the art to the patients who are ill and come to the care of all of our physicians at University Gastroenterology.
Great. Very, very exciting things to come. Dr. Nadampally, you're, we should mention, out in Portsmouth. So liver specialist, gastroenterologist, but also conveniently located out of Portsmouth. So those folks in Rhode Island who don't like to travel far, they can see a specialist like you out on the island. Talk about some of the other types of liver disease that you treat. You came to this this group, by the way, with that interest in liver. Talk about some of the other things that you treat.
Yeah, that's correct. When I joined the group and kind of joined out in Portsmouth, I was excited to be able to offer some treatment of liver disease and a little bit of experience in that to the patients on the island. As you mentioned, a lot of times people feel more comfortable staying close to home, and having UGI have a presence on the island through me has been helpful. Certainly there's a wide variety of liver diseases. As Dr. Sepe touched on, fatty liver disease is one of the current diseases that's booming. We're realizing how big an impact this has on patients. It's a disease that many people suffer from. The rates of it vary, but estimates are anywhere between 10 and 40% of Americans may suffer from this. And it can lead to real consequences down the road. It can lead to cirrhosis, it can lead to liver failure. So this is one of the areas that as we continue to offer treatment for hepatitis C and hepatitis B, we've thankfully got great treatments for hepatitis C, and those patients that I see with hepatitis C are only going to see me for a while until we eradicate it. But fatty liver disease still has no clear cure at the moment, apart from the difficult interventions of lifestyle changes. There's a lot of exciting research going on there, and Dr. Sepe has been instrumental in putting us in a position to be able to offer some of those clinical trials to patients, hopefully in the near future. But with fatty liver disease, it's such a prevalent disorder and has so many consequences for patients that it's exciting to watch it evolve and hopefully get to a point where we can offer real interventions for patients that can be workable and can really make a difference. And
that fatty liver, can we talk about one of the other treatment or diagnosis you have, Brandy, we'll ask you this question with the non-fatty liver, the NASH, and talk about the diagnosis of that and why that is such a problem for the patient population.
You know, we have a lot of patients that are referred into the office and the clinic for NASH because of, you know, Dr. Sepe and Dr. Newton and Dr. Nampali being liver specialists, but also the clinical trials, you know, that we have available to help these patients. But there's a huge unmet need. We're diagnosing more and more patients in their earlier years of life, in their third, fourth, and fifth decades of life, with advanced liver disease and cirrhosis because of uncontrolled diabetes, obesity in our children that are, you know, leading to patients with heart disease, hypertension, high cholesterol that aren't being well controlled. We don't have medication right now. That's why we're working on these clinical trials readily, because we need to impede on the process that puts fat into the liver. We need medications to help reverse fibrosis in patients with advanced liver disease. But the real focus, what we still educate patients on, is dietary modification, aerobic exercise, and weight reduction, because it all comes full circle. That will in turn help to control their diabetes better, which will help in turn not to have such fast progression of their liver disease. And I think if they're educated on what they can do to empower themselves, in addition to the drugs that we're helping to develop, this will help them long term.
And Dr. Newton, the current situation we're in with COVID-19 and people's behavior changing, we've spent a lot of time and effort to make the public aware of the issues with being overweight. And now we hit this 3-4 month period of time where people are eating more, drinking more, not exercising. Do you foresee an increase in some of these liver issues as we go on in the next months and years?
Yeah, certainly. We've, at least in my practice, I've seen an influx in some people who certainly are drinking more alcohol during the pandemic, and there's been a little increase and bump in the number of liver-related problems that we see due to alcohol intake during this time. And then, as you mentioned, people are eating more and gaining some weight, and in general, the obesity and epidemic of fatty liver is a slow progression. And so even if you gain, 10 pounds, 15 pounds during a couple months when you're at home and eating more than maybe you should, it's not necessarily something that we see as being a big problem a month from now or 2 months from now, but that's more of a problem that we see sort of years as that problem continues. It catches up to you eventually after years of being overweight and having this issue. So it's not necessarily a correlation that we'll see right away, but it is a problem. And so I would encourage people as much as possible to take advantage of the time that you have to maybe start exercising a little bit more and seeing if you can fit in a daily walk and 20-30 minutes of aerobic exercise and moving your body and trying to burn those calories rather than stay at home and intake them or eat them. Sure.
And Dr. Sepe, we've talked for years about this and non-alcoholic fatty liver disease and that it's unseen and one of these problems that will come up in the next 5, 10, 20 years and be a serious issue. What's your advice on this and what should people be thinking about when they have this time on their hands and they're at home?
I mean, to really echo the points Eric has made, I think the real key right now is to be aware of weight. Everyone in our society needs to be aware of excess weight because it's linked into many factors, and diabetes is a separate risk factor for progression of liver disease when there's NASH and fatty related liver disease. The other point to make that is if your liver doesn't get you, your heart will, because about half the patients who have well-established NASH related liver disease will develop important comorbid cardiac disease. So if they have a cardiac event, it's even more difficult for them to try to lose weight and change habits that are already, kind of beyond improvement. So it begins now. It begins with primary care physicians. It begins with us. It begins in the pediatrician's office, because I think the number of obese children and adolescent obese children in this country is staggering, which is giving us a feed for even more fat-related liver disease in the very near future. In fact, I think Brandy and I have diagnosed at least 4 patients with cirrhosis in their early 30s from NASH-related, liver disease in just the last couple of months. So it's a real issue. I think, it's not being talked about now. Obviously, everything that's being talked about in medicine is usually pandemic-related. But I think very soon, I think the estimate I saw, the biggest healthcare expenditures in the next decade are going to be from dementia and from fat-related liver disease in the United States.
Wow, that's amazing. And studies have come out this week about obesity and obese patients not dealing well with COVID-19 as well. And we'll shift topics a little bit. Dr. Nonfatty, your practice and the whole practice in general has had to shift with COVID-19. Talk about some of the measures you've taken to make sure that your patients have the safest experience.
Sure. Just like everybody else, we've certainly faced our challenges in trying to keep patients safe, but also keep ourselves available for patients. So there's a number of measures we've taken. One of the most important early on, and which we continue to offer, is telemedicine visits. So trying to keep patients at home, keep them out of harm's way, and trying to keep them out of waiting rooms has proven to be helpful. And surprisingly, I think we're all a little bit surprised by how effective it's been, and how much patients have kind of risen to that challenge of being able to manage the technology for it. It seems daunting at first, but it actually is a lot easier than most patients are expecting. In addition to that, we've been taking measures at our offices in terms of making sure we meet CDC guidelines for cleanliness, making sure we do periodic cleanings through the office. Also limiting the capacity of our waiting rooms, spacing patients out, and taking the measures that we can to try to limit patients' exposure, limit their loved ones' exposure to COVID-19.
And some of the major screenings that you do at UGI, Brandy, I'll ask this question. How important is it not only for the liver screenings, but for the other screenings that patients do come in and follow up and not let these things go?
Yeah, I mean, it's very important. We can't put everyone's healthcare on hold because of COVID. Our cirrhotic patients stick out the most to me. Our hepatitis B patients stick out to me because they're at risk for liver cancer. So it's extremely important that they have their routine imaging of their liver to screen for primary hepatoma. We tell the patients, these facilities are very safe now, as it is here with ours. They go in, there's all precautionary measures taken. It's probably safer for them to go to a facility right now than it is to go into the grocery store. So it's very important that we keep up with that, because we're diagnosing, liver cancers readily, and it's much easier to find them when they're small and treat them than when they're the size of a cantaloupe, because they're afraid to come in to get their health care taken care of.
Sure. And Dr. Newton, do you see an uptick in the patients coming in now for their colon cancer screenings, or are people coming back, or do they still need to be reminded to get on the phone and call their primary care physicians?
I think it's a little bit of both. We are, we're lucky enough to be living in a part of the country where the numbers are still a little bit low for now. So I think, people are starting to come back in. But I certainly would encourage people to talk to their docs about it, to not really put it off. We are here doing procedures and here for you. And I was talking to Dr. Seepy about this yesterday. We're seeing a rash of big polyps and colon cancers as of late. And part of it may be that people put stuff off for a little bit longer than they should. So please don't, if you have any symptoms of any kind, change in bowel habits, blood in your stool, new constipation, diarrhea, please certainly speak to your doctor about it. Let us know about it. But be reminded that oftentimes colon cancer has no symptoms. So you may think that you're fine because you have no symptoms, but that's really not the case. So stay on top of your screening, make sure you come in for it, and please don't delay it more than you should.
And Dr. Seepy, as we talk about symptoms, COVID-19 does have some GI symptoms. Should folks watch out for this if they think they came into contact with somebody, or there's some symptoms that may come up?
Absolutely. I think from a general perspective, I think the prevalence of GI-related symptomatology is probably approaching 50 to 60% in people who are actively symptomatic with COVID. Remember, there's a large proportion of people who don't develop any symptoms, but they're important vectors in spreading the infection. But for those who are symptomatic, GI symptoms are very, very common, and loss of taste and smell is actually something that can be, portending active respiratory demise in the near future. So I think that part of it is there. The other thing that's interesting, since it is World Hepatitis Day, that about 60% of people who get hospitalized with acute COVID infections, which are usually respiratory complications, but others do have evidence of hepatitis on their blood parameters. In fact, there have been some very significant forms of even decompensation, but much less common so. So I think we have seen, when we do our inpatient rounds and work, early on, actually, I was involved in someone who clotted off one of their big blood vessels to their liver when I was on call early in the pandemic, and actually did not survive that complication. So, yes, COVID does affect the gastrointestinal tract. It does affect the liver in very profound ways. And for patients, if you lose your sense of smell, you feel washed out, you're developing some very, general GI symptoms, you should be aware of it, and you should call your primary care physician and probably be tested. I think testing theoretically is more accessible right now, not as fast as it was, but I think you should keep those concepts in mind.
And since we are doing this live on the 28th, and we did have some breaking news that we had discussed earlier about a few Patriots players opting out of the season due to COVID-19, and knowing you're a Patriots fan, are you surprised that this is happening? Is this something that came out of the blue, or is it something you expected?
I think that human nature can be weak. I'm not sure why patients are, or if there are players opting out. In baseball, we've heard that there's already a fairly mass infection of the Florida Marlins. It's very disconcerting because you can try to take protective measures, but if people aren't careful for one instant, right, you can catch this infection. It's like that with many forms of infectious disease. All it takes is one mistake and you're therefore infected. So I'm worried about the big football fan. I'm worried about football. I'm not sure baseball is going to be here much longer. The NBA experiment is interesting because they're trying to create a safe bubble, but there have been some bubble heads there that have not followed the rules and have gotten, risk brought into the pool. So very, very tricky situation. I'm glad I'm not involved in trying to help make those decisions at this point.
Sure. We don't expect you to predict the future, but since everyone is talking about this, it's very relevant to all of us. Figured I would bring that up. But I think some great information here. As we conclude, I'd like to go around and ask you all for your final thoughts and your advice on World Hepatitis Day, as it applies to your patients and those out there who probably should get screened. So Dr. Nadampally, I'll start with you. What are your last words of advice here?
Well, I think the biggest take-home message from a day like today, which is meant to raise awareness, is to be aware, to make sure that you are advocating for yourself, talking to your physician about making sure that you're screened if it's appropriate. As Brandy mentioned earlier, the guidelines for screening for hepatitis C have expanded considerably. And today we recommend screening for everybody over the age of 18, regardless of risk, regardless of everything else. And so making sure that your physician has tested you, making sure that you've been screened and cleared, or screened and then directed towards one of us to help kind of guide you through it, I think is important to keep in mind.
Great. And Brandy, what are your thoughts?
I would have to say, the COVID pandemic has been horrible, but we can't let that get in the way of healthcare. Patients still need screening colonoscopies. They need screening for colon cancer. Cirrhotic patients need screening for liver cancer. COVID shouldn't allow us to make unhealthy lifestyle choices. There's still, healthy eating choices we can still get out there and exercise, even though we can't go to the gym. There's bike paths, we can get on a bicycle. There's access to swimming. We can get out there for a walk. It promotes self-care as well as overall care for moving forward from here on out.
Sure, great advice. We live in a great place to get outside and do that right now. Dr. Newton, what are your thoughts and advice?
So my advice, just along the theme of finding the missing millions, is go to your doctor and at an annual regular visit, have them check your liver function tests. And don't ignore even mild abnormalities of those tests. Because I can't tell you the number of times I see patients late in the disease process where they've developed scar tissue and damage and cirrhosis of the liver. And you ask them about their history of liver problems and they say, well, yeah, I've had some abnormal liver tests, but they were just mild and, I didn't think it was a big deal. But I tell my patients all the time that any process or any problem in the liver that creates even a small amount of inflammation over a long enough period of time can damage your liver and lead to scar tissue formation and cirrhosis. So even though your liver test might only be mildly abnormal, make sure you talk to your primary care doctor about it. And at times you may be referred to a specialist such as ourselves, but pay attention to it and take it seriously. And even though those labs might be only minimally abnormal, it can be a serious problem. And that's why we're here, is to help take care of people like that with those issues. Just get a basic set of liver tests done. And that way we're going to start finding more of the missing millions.
Great. And Dr. Sepe, we'll wrap up with you. Give us your advice, please.
I'll give a perspective. I'm beginning my 28th year of practice, and I'm more excited than ever that I picked hepatology as my subspecialty. I think right now the message to all of our patients is that liver disease is preventable with alcohol, with weight. Liver disease is treatable and curable with hepatitis B and C. Liver disease is preventable with being careful about using potentially liver toxic drugs. So, long time ago when I first began this, most of our diseases we couldn't treat. People did poorly and we were treating complications. And while all of us spend a lot of time treating people with advanced liver disease or trying to get them new livers and transplanted, the key message now is that liver disease is treatable and reversible with appropriate guidance. And, we're all excited here at UGI and our liver center that we really bring a lot of experience and enthusiasm to that whole process.
Great advice from you all. Thank you all for taking the time today. Very important day here. And we'll do this again next year to remind people amid everything else going on. So thanks again for the great advice, everybody.
Thank you, Pete.
Thanks, Pete.
And for those watching, if you have questions, reach out to universitygi.com. Give them a call if you want to talk privately. Any one of these providers would certainly be willing to talk with you. We'll have a copy of this online as well. If you missed any part of it, it will be on YouTube and on Facebook as well. So thanks again. Be safe, everyone, and have a great evening.
Rhode Island Quality Institute recently named University Gastroenterology a top performer among more than 350 regional healthcare organizations. Our doctors are specialty trained and nationally recognized for their expertise in general gastroenterology, inflammatory bowel disease, liver disease, and therapeutic endoscopy. Our main campuses in Providence, East Greenwich, and Portsmouth house state-of-the-art ambulatory endoscopy centers to provide a caring and cost-effective environment. To learn more, please visit universitygi.com.